All right. We have a full house today, everybody. I'm so excited that you decided to spend your lunch hour with me. I'm going to go ahead and get started because we have a lot to cover and I want to be cognizant of your time. A couple things to share right away. This is obviously being recorded. You will get the recording afterwards, so you can share it with your team members that maybe couldn't join today. You'll also get a PDF of the slides as well. So I'll send that all out in an email after the webinar, either today or tomorrow. You'll also get a variety of different links too that I'll talk about today. Feel free to ask questions either in the Q&A or the chat box as we go along, but I'll answer them at the end because it's just too hard to go back and forth between the two. But I don't want you to forget your question. So even if it gets answered later on, go ahead and put it in there just in case, because I don't want to miss it later on. I am going to turn my video off for the majority of this. I'll turn it back on at the end, only because I have several videos that I wanted to play, and it just helps with broadband and Wi-Fi and all that fun stuff. So with that, I'm going to go ahead and get started. First, big shout out and thank you to the Arizona Department of Health Services. It's because of a great partnership with them that we are here today, that I'm talking to you all the way from Iowa. We have launched Count the Kicks in your great state, the Stillbirth Prevention Education Campaign. We're so excited to be here. I'm so excited to talk to you all. I love home visitors. I love what you do. I think it's so important. You truly are the boots on the ground, the grassroots. And so you'll hear me say that a lot, but hopefully you also hear my passion and excitement because I truly do love what I do. And I'm excited to be here talking to you today about Count the Kicks. Obviously, this is me. I'm the program director with Healthy Birthday, which is the nonprofit organization that created Count the Kicks. Count the Kicks is a stillbirth prevention education campaign, which you're going to learn about today. I had some really cool polls in here and then it all like crashed. So I would love for you to tell me in the chat box if you have heard about Count the Kicks before today. Yes or no. You're not, it doesn't matter what your answer is. I just want to know yes or no. That just gives me a good gauge. A little bit about me. I've been with Count the Kicks for about 3 years. My background is in public health. I worked for Iowa Department of Public Health for several years in tobacco prevention and education. I have about 15 years experience in public health with a background in global health as well. My true passion is truly prevention, education, and empowerment. I especially love systems level change. So when I get to that part of the presentation where I talk through like different ways you can integrate this into your workflow, that's where I want you to be thinking, like, how could you take what you learned today and make this common practice? So we'll talk about that later on. Like I said, I live in Iowa. I've lived here my whole life, but I did go abroad several times and did a couple of things with my global health practicum. And I just realized I was not so bad. So I have 3 young children, and I'm just excited that you're, like I said, spending your hour lunch with me today. Feel free to always contact me too. I love hearing from you all. I love knowing more about what you're doing, what needs you have, and how we can help you. So before we jump right in, I want to share a video with you. And I share this video for a couple reasons. The first being it's a feel-good video. I know it's the afternoon and it's like, oh, we're eating and then we're going to get tired. But this is going to bring a smile to your face. And when you leave today, you're going to remember this presentation and you're going to remember baby Ruby. This is a story about how baby Ruby was saved when her mom noticed reduced fetal movement, spoke up to her provider, and Ruby's here and now a 4-year-old because of it, 4 or 5-year-old. This was in 2017. I share it also because I might reference some of the comments made, but it also does a really good job. If you're not that familiar with Count the Kicks, it does a good job of showing you exactly how the app works and why it's so important. When this aired in Good Morning America in 2017, we saw a 3,700% increase in our app downloads. The power of storytelling is unmatched. Anytime you can share stories like this with your expectant parents, with your families, anytime you can go to our YouTube channel, you can go to the app and share the videos, share it with your expectant parents, because this is what they're going to remember. And this is what's going to make them think, oh yeah, I need to download that app. I'm in my 3rd trimester. So let's go ahead and watch about baby Ruby.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So cute, that little stretch at the end. So she's a big sister now. She's got a little sister, Ren, I believe her name is. So let's level set. I'm sure you all know the definition of stillbirth, but just in case, I always like to start off the presentation with this to make sure we're all on the same page of what we're talking about today. So miscarriage is usually defined as the loss of a baby before the 20th week of pregnancy, and stillbirth is the loss of a baby after 20 weeks of pregnancy, and it's further classified as either early, late, or term. You can see those definitions there. Infant mortality, which tends to be the one that gets most confused with stillbirth, is death of an infant before his or her first birthday. So today we're talking about stillbirth and stillbirth prevention. And what I really want to draw your attention to on this slide is the fact that we're losing on average 23,500 babies a year to stillbirth. And for infant mortality, we're losing around 22,000. So we're losing just as many babies to stillbirth as we are to infant mortality, but we don't talk about it. We're not talking about stillbirth as much as we talk about SIDS prevention and laying your baby on its back. And that's not to underscore the importance of those prevention methods and the importance and devastation of infant mortality. What it is shining a light on the fact that we need to be talking about stillbirth and stillbirth prevention just as much as we're talking about infant mortality and SIDS prevention and back to sleep. That's 65 babies a day are born still. That's a busload of kindergartners if you break it down like that. So this is truly, truly happening, and we need to be talking about it. 1 in 169 pregnancies ends in stillbirth, and the racial disparities are large. The Black women, Black moms, 1 in 96. Black women are 2 times, sometimes 3 times, depending on the state, more likely to experience a stillbirth over white women. Latinx moms, 1 in 199. Indigenous women, 1 in 138. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. Again, just as prevalent as infant mortality. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. So that's national data, but let's take a look at your data specifically for Arizona. So based on the most recent 5-year average, the stillbirth rate in Arizona is 5.92 stillbirths per 1,000 live births. So on average, you're losing around 490 babies every year to stillbirth. In Iowa, we're saving 1 in 3 at-risk babies. We've had a 32% reduction, which I'm going to talk about here in a second. So when we do all the math, we have the potential of saving 157 babies from preventable stillbirth in your state. So you can see on that graph there, you've had a slight uptick there in 2018 to 2019. Stillbirth data tends to be about a year and a half or two behind. So that's why I only have 2019 up there. But you can see that there was quite a big drop in the national rate, but you guys went up in that year. So that's something that we monitor yearly. We work with our state health department there, the EPIs, just to make sure that we're monitoring everything, because we want to track that. And then I also have race breakdown data for you. This is 2019 I wrote out, but you can see in the bar graph there, the Black or African American rate is 11.77 compared to the white rate, which is 5.45. So definitely 2 times more likely to experience a stillbirth. And then your American Indian, Alaska Native, your indigenous population is probably one of the highest I've seen. And that when I get to see race, not all states I have this type of race breakdown. I'm very happy that Arizona does and shares it. And so this is really something to know and monitor. And this is why we're talking today. This is why I need you all to help me get boots on the ground, sharing this information so we can decrease all of these numbers. And then the Hispanic Latino rate, 5.98, Asian Pacific Islanders, 3.47. So we have some work to do. And this is exactly why we're so happy to be partnered with the Arizona Department of Health and Human Services. So when I talk about the fact that we've had a 32% reduction in the stillbirth rate here in Iowa, this is what that means. So in Iowa, the campaign began in 2008. From 2008 to 2018, we saw a 32% reduction in the number of stillbirths. In the first 5 years of the campaign, we saw a 39% reduction in the number of stillbirths among African American women here. And so public health officials have stated there really wasn't anything else going on in Iowa that would have made such an impact. It's not like every pregnant woman received doula care, which would be amazing. It's not like obesity rates decreased. In fact, those increased. So all these other risk factors have increased, yet our stillbirth rate has gone down. And so we're excited to see this. We want to continue to see it go down. And this is what we want to bring to Arizona. So when I talk about on this slide, we have the potential of saving 157 babies. That's that 32% reduction. Hopefully we blow it out of the water and we do even more. The goal is really to get me out of a job, right? Like we want to save all the babies from preventable stillbirth. We know that not all stillbirths are preventable, but the ones that are, we want to be part of saving and having those stories of baby saves. So why are there such large disparities for stillbirth? I think it's really important we take a moment to talk about this, to address it. Things like systemic racism, toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African-American woman in a systemically unjust society and everything that comes with it, has led to real and pervasive health issues for Black women. Epigenetics, predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, which are all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. Access to healthcare, socioeconomic barriers, but research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So what are we doing to reduce these disparities that exist in persistent stillbirth? And what can you do? So some of the things that we're doing is we have an app in 14 languages. We can continue to increase that. We're going to be adding Portuguese here this year as well, and Hebrew. We have culturally appropriate educational material. We have videos, printed educational materials, and FAQs in multiple languages. We have a health equity director we're hiring. We're hiring a health equity coordinator. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism, improving programming based on the lived experiences shared by people of color, working within communities considered to be marginalized, and working outside typical healthcare settings. And I'll talk in a little bit, what we're doing specifically in Arizona to be more culturally relevant. And just a big shout out to the health department, because it's because of them that we've been able to create some messaging and pieces specific to different demographics there. So before we dive into the app and everything, I just want to highlight that this is an evidence-based campaign. This is research-backed. And so if you're really into research and you love reading journal articles, because I mean, seriously, who doesn't? You can go to our website on our evidence page, and we have a whole slew of research articles you can read. But if you're not that into reading research and spending your hours diving through that, we have one that I highly recommend you read, and it's really not very long. It's about 4 or 5 pages. And I want you to read it because it's the one that started it all. It's this research article that you see. It's also on our website. And what I mean by started it all is, I mean, we were founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time of their loss. They got connected through pastors and friends. And as they started kind of connecting and grieving together and meeting for coffee, they were sitting there thinking, this is odd. Like, we were told this isn't that common, yet here we all sit, relatively the same time period this happened, relatively the same story, and yet we're told it's like getting struck by lightning, which is not right. It's, you're more likely to have a stillbirth. And so one of the first things they did was they created the first ever stillbirth registry with CDC, a way to track the trends of stillbirths happening in Iowa. And it was because of this funding from CDC that they went to a public health conference and spoke about that CDC registry. Well, while they were at this public health conference, a couple of the founders heard about this research out of Norway that showed when expectant parents were educated on the importance of tracking their baby's movements in the 3rd trimester, among this cohort of pregnant women, the stillbirth rate decreased about 30%. And so the founders hearing that said, well, that's amazing. Like, we can do that. We can create a stillbirth prevention empowering campaign about the importance of tracking babies' movements and bring it back to Iowa. Like, let's do that. So they came back to Iowa and they worked with Iowa Department of Public Health. They looked at other research out there and created what we all know today as Count the Kicks. So an empowering, parent-focused campaign, a way for you to have the tools and resources to talk about stillbirth and stillbirth prevention, and a way for expectant parents to understand the importance of fetal movement monitoring. And so Dr. Ruth Fritz, she's also on our medical advisory board, and she was the only US researcher on this Norway study. And she said, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. So you're going to hear me reference quite a bit that normal movement pattern, and that's really important. So we'll talk about that here shortly. I also want to stress the fact that one of my top questions I always get is, this is just going to increase anxiety, right? Like, I don't want to tell anybody about this because they're just going to be so worried about their baby's movements. And so I want to assure you that kid counting does not increase anxiety in most pregnant women. This research study stated that one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true, and that usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. We've also done our own study on our app users. We have thousands of app users. The Des Moines University and the Harkin Institute did a study and found that 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. They also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, preliminary research shows the mobile health app increased in awareness of a change in fetal movement and a reduction in stillbirth. And then I also want to stress the fact that this has added benefits. It's low cost, it's non-invasive. I think everybody thinks they're going to track their baby's movements and they're all going to rush to the ER all the time and have emergency C-sections. We have not seen an increase in our C-section rate here in Iowa. Because what happens is you now have a highly educated person with data in their hands to say, I know my baby's normal. I have the app, I have the data, I know when to speak up, and I know how to speak up. So it could also help show signs of, maybe babies trying to get born a little early. So preterm birth rate can be caught early and fixed. Fetal growth restrictions can be identified earlier. And we also know that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So not only could we potentially prevent preventable stillbirths, but we also have an opportunity to catch some things going wrong with mom and it potentially save her life. So I love this quote from another research study that says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So we just recently released a white paper with the Harkin Institute titled The Link Between Stillbirth and Maternal Mortality and Morbidity, Firsthand Accounts from American Women. So I know I just talked about this and you know, stillbirth and maternal mortality are intrinsically connected. But what I really want to stress is the fact that you're 4 times more likely to die if you have a stillbirth. So what we really wanted to do was highlight the fact that we have this evidence-based tool that can help bridge the gap. We know that maternal mortality and morbidity is on the rise in this country. And so let's think of these solutions that we can work together on to prevent both of these from happening. According to one study, more than 15% of maternal deaths within days of delivery occur in women who experience stillbirth. I'll send this out. You don't have to, you can scan the card or the code if you want, but I'll send this with my post-webinar email, but it's also on our website. So feel free to review it and share it as we go about. All right, so how do you implement this? You know about the data, you know about the research. Why do movements matter so much? Movement is one very important way a baby communicates before birth. A change in baby's movements can be an early sign and sometimes the only warning sign that baby may give when in distress. There's really 3 types of movements that I want you to be aware of. One is the most obvious. Baby has fewer or no movements, they slow down. The other one is baby may move, but movements are softer or weaker. If you think back to baby Ruby's story, when her mom said her movements just felt weaker, they weren't normal, that's where we're talking about the strength. And then there's this 3rd type of movement where research and lost moms have said and described it as almost like a wild surge of movement, a painful surge of movement. It can also be an important sign of distress. So that's why I can't stress this enough. The whole point and the whole education around this is really understanding what's normal for your baby so you can speak up to your provider. And that's what you're going to want to stress with your parents that you serve. So when do you want to start talking about this with your clients and with your families? We want you to start talking about this at 28 weeks. So right at the beginning of the 3rd trimester. If you know your expectant parent is high risk, start talking about it at 26 weeks. This is really when research has shown that baby establishes a consistent pattern that we can feel and track. So then you're going to get asked, well, what is it? What is it? Count the kicks? Is it just kicks? It's rolls, it's kicks, it's jabs, it's swishes, it's any type of movement like that. Anything except hiccups, which are involuntary, so they don't count. So this is it. This is how you talk to your expectant parents about it. You want to utilize count the kicks so they can be in tune with their baby and their body. So again, starting in the 3rd trimester, you're going to say things like, hey, have you heard about Count the Kicks? I want you to start tracking your baby's movements with this free Count the Kicks app. You can also use paper kick counting charts that we have on our website. You can count, we want you to count your baby's movements every day. This is key. We want them to count, we need them to count every day, preferably around the same time. That's how they're going to notice that pattern and the trend. They're going to time how long it takes their baby to get to 10 movements. And then after a few days, they'll begin to see a pattern for their baby. The average amount of time it's taken baby to get to 10 movements. Continue tracking every day. And of course, call your provider right away if you notice a change in how long it takes your baby to get to 10 movements or the strength of those movements. And that's how simple it is. And we make it even simpler because we have an app. So right now, one of my favorite parts of the presentation is I ask you to multitask. I ask you to take out your phone because we live in the United States and I know we can all multitask. I want you to take out your phone and go into your app store and search Count the Kicks. I want you to download it. I want you to set up a pregnancy profile and use it. And I want you to do this because I want you to see how easy this is. I want you to see how user-friendly it is, how colorful it is, so that you can pull your phone out when you're talking to families and say, look how easy this is. Let's set up your pregnancy profile. So while you're doing that, I'm going to talk to you about some of the features. So of course, it's in 14 languages. If you need a language that you serve, a demographic you serve, and you don't see that language on the screen, let me know, because we're continually looking for funding opportunities. We could work with the Arizona Department of Health to say, hey, this is what we're being told is the need in the community. Like, let's make that happen. That's exactly how we got Haitian Creole on the app. We worked with a Healthy Start in Florida who said, we serve a lot of Haitian Creoles. We would love to see that in their language. And so we did it. And so it's for Apple and Android. So how it works is when you're ready to start counting, you've picked that time, you know, baby's most active, maybe it's right after lunch or right before dinner, and you sit down, your feet up, you hit start counting, and then you feel that first movement that you want to start with, and you tap that footprint that you see on the screen. So as soon as you tap that footprint, a timer starts. So every time you feel a movement, you tap that footprint until you get to 10. After you get to 10 movements, the timer will stop, and then you'll see that picture there behind there is the average amount of time it takes baby to get to 10 movements. So after a couple sessions, the app user is going to be able to see, oh, it takes my baby about 15 minutes to get to 10 movements. I know that's their normal. So if one day they're counting and all of a sudden, let's say, for example, it took, I don't know, an hour and 20 minutes or 45 minutes or 50 minutes, that graph is going to change. That line is going to have a sharp increase. So they're going to see that as a visual representation and say, that's not my baby's normal. My baby's normal is around 15, 17 minutes, not an hour and 15 minutes. So they will contact their provider, see what they want to do, go in for testing, make sure baby's okay. 9 times out of 10, it's probably okay, but we want to make sure that we catch that one time. So it's really simple to use. You can restart a session or delete a kick. You can set daily reminders. So make sure you're encouraging your expectant parents to set their daily reminders, so they don't have to think about it. Like, it just does a cute little push notification that says, hey, it's time to count your little kicker, things like that. They can review kick counting history. They can actually download their data and share it with their provider. So again, now you have data in their hands. It's basically like their intuition download of how baby's been moving, how baby feels. They can share it with their family and friends. You can count for single babies or twins. You can track future pregnancies on the same profile, so you don't have to set up a new account every time. You can manage multiple devices. I could be counting on my iPad one day and the next day on my watch, and it all syncs together. Or my significant other could access it on their phone and be part of the process. They could see, oh, my baby's been moving, like it takes 20 minutes to get to 10 movements. And it's also available on the smartwatch as well. Another part of the app that I wanted to stress, this was released last year, and this is our strength tracking and notes feature. And what this does is shows you, research shows that not only expectant parents should be tracking movement, but how strong those movements felt. So think back to Ruby again, and her mom noticed the movements felt weaker. And so let's say I'm counting, right? I'm tapping the little footprint, I get to 10 movements. What you're going to see then is that screen that says almost done. Please fill out the following fields to finalize your kick session. And users have an opportunity to mark either 1 through 5, basically. 1 being very fluttery, light, those movements, if you've ever been pregnant before, they feel very like, I always said they were like gas bubbles or like butterfly wings in my stomach, all the way to fierce. So very, you might see like limbs poking out or movements like that. Whatever the movements feel, that's what you track. And the most important thing is to know that the strength doesn't decrease, right? The strength doesn't change like that. So again, you're going to get a very visual representation in a bar graph of the average movement and then the day-to-day strength. So that final image that you see there is what they see before they hit finish session. And so for this example, you can see baby seemed pretty linear. The movements were about the same every day. And then all of a sudden it shot up. And also the movement strength went down. I'm not saying that these have to connect or coincide. What I'm showing is just a visual example of how visual this is. So this would be a flag to mom to say, I should call my provider. This is not my baby's normal. You know, this is not okay. I need to call and see what's going on. And that's it. We also have a lot of other great resources and tools on the app. We have videos. So remember how I talked about that mom to mom storytelling? Have them watch all the videos on the app, have them playing in your waiting room, like work with me on it. I'd be happy to share those with you, the raw videos. So you could do that on like a streaming. But these are all on the app as well. And then we have a ton more on our YouTube channel. And then one of the newest features that came out in January of this year is our Find Help resource. So we know that we want to make sure that people have the care and the services and the resources they need prenatally, because if we can impact moms prenatally with things that they need, the chance of that baby experiencing adverse childhood experiences can decrease significantly. So this is a free resource where people can search for free or reduced cost services. So maybe they're searching for housing assistance or childcare assistance. All they do is go into the resources section of the app, or you can go to that website there and they put in their zip code, and then it's going to show them a variety of different programs. They can filter it by what they're searching for. This is continually updated. So if you have a list of food pantries that are not on there, send them my way. We will make sure they get on there. People can find it within their zip code. So this is an example in my area. And so I just think this is another great feature that we're trying to connect prenatally to services in their area. And then this is a video that's on the app. It's super short, simple, but it really goes through how to use it. So let's go ahead and watch.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So one thing that I want to share, and you guys are my first group to share this with, so be excited. We are also launching a web counter. So that will be out probably in August. And the reason I'm telling you now is to be aware of it, because I don't know when I'll see you again next or present about it. But be on the lookout for that. Sign up for our newsletter if you haven't already. So when we announce it, you'll have that. And the whole emphasis of this web counter is it's the same premise as the app. It all connects together. But then we can reach people that maybe don't have Wi-Fi, that maybe can't use their smart devices all the time, and they can only count babies most active like at 2 o'clock in the afternoon. They get a 10-minute break. Maybe they can count on their work computer, or they can go to a public library and count, or a friend's house. And so all the same features will be on there, all the same languages, but we're super excited about that release. So enjoy, because you guys were the first ones to know about that. So that will be coming down as well. So how do you integrate this? How do you talk about Count the Kicks? How do you talk about stillbirth and stillbirth prevention with your families? First, I want to stress to you that health literacy is one of the strongest indicators of an individual's health status. And what Count the Kicks, what this training does, what this webinar today does, it gives you the tools and resources to be able to increase your clients' and families' health literacy. And how you do that is you're doing things like you're being equitable. You're avoiding assumptions, then you're providing all expectant parents with this, no matter their race, their gender, their religion. It's the same information and interaction, no matter who you're talking to. You're listening and you're learning. You're asking strategic and open-ended questions about kick counting. You're using motivational interviewing techniques, making sure that your family, your patient, your client, they understand you understand their feelings and their desires, and you can empathize with them. You're being clear and concise. You're avoiding long or complex explanations and medical terminology. Consider everyday vocabulary, which we'll talk about too. And you're being honest. You're speaking the truth. Stillbirth is a scary, dark, tragic subject that nobody wants to talk about. And we're going to talk about that on the next slide. But I have to remind you, and you all know this, we learn all sorts of things during pregnancy. We take all sorts of blood tests. We do all sorts of ultrasounds. We tell people not to take folic acid and not to drink. And, this is the same. We should all be told about stillbirth and stillbirth prevention and things that we could do that could potentially prevent our babies from being stillborn. And then reteach, right? Ask questions back, what other questions do they have? This is where you could also ask them to show you their kick counting chart, that type of thing, having that extra support. So again, how do you do this? You don't want to scare moms. Like I just said, pregnancy is full of risks that we talk to people about. Stillbirth is another risk that moms deserve to be educated about. I can guarantee you they would much rather have been told about this up front than after something happens. Stillbirth just happens. There's nothing we can do. There are warning signs if people know what to look for. A change in baby's movements is one of the only warning signs that baby's in distress. You're going to get this next one. My baby's always active. I guarantee you, when you go talk to your families about what you learned today, they're going to say, oh yeah, I don't need to do that because baby always moves. I'd never get a break. It's like a jungle gym in there. I know you're going to get this because I said the same thing when I was pregnant with 2 of my 3. My third one, we'll talk about her in a second, but you're going to get this because I get it when I talked about it with my friends, family members who are pregnant. And I always have the same response. I always say, that's great. Healthy babies are active babies. But it's still really important to know if your normally active baby has slowed down. It really takes the guesswork out of knowing that. So you don't have to think to yourself, is it 5 minutes? Like, I don't know my baby's normal because I thought they moved all day, but they haven't moved lately. It just takes that guesswork out of that because cord and placental accidents can be sudden. And then she's almost at her due date. You might hear this a lot if you work with a lot of multi-generational households. I remember my grandma saying things like, oh, you're running out of room, or, and stuff like that. So the risk of stillbirth increases significantly as mom passes her due date. So that's something to be aware of as well. Some other common myths that you might get. So I want to make sure we address, of course, we just did the active one. I stress it a couple different times in a couple different ways so that you can have that knowledge and take that back with your team and with your parents. Only those experiencing a high-risk pregnancy should pay attention to their baby's movements. We want all expectant parents to understand and be educated and count the kicks and get to know what's normal for their baby. We don't just talk about the gestational diabetes test, right? Like we just don't do the glucose test for those that are high risk. Everybody gets that test. Oh, a common one, 10 and 2. My doctor said I need to do this 10 kicks in 2 hours, or I've heard 10 and 1 before. So every baby's different. The recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements. And I'll tell you why. This is, there's a research study on our website on the evidence page about this. And basically what it says is, as humans, we focus on time, right? You're here for an hour, you have about 20 minutes left, we're focused on that. Same when we're counting, right? So if I get told I need to make sure I get 10 kicks in 2 hours, that's what I'm focused on. So let's say I'm counting, and really the past several weeks, baby's been taking about 15 minutes to get to 10 movements. And one day I'm counting, and all of a sudden it took, I don't know, an hour and 47 minutes or an hour and a half. But I think to myself, that's okay, because I still got 10 kicks in 2 hours. But that's not my baby's normal, right? my baby has been getting 10 movements in about 15, 20 minutes for the last 4 weeks. And now all of a sudden it takes almost 2 hours. But so we really want to focus on what my baby's normal is and to speak up to their provider if that changes. I can use a Doppler device. I know there are apps out there on phones. I know with the whole pandemic, when appointments got stretched out, people were doing that. But again, a change in the baby's heartbeat is one of the last things to occur when a baby's in distress. A change in a baby's movements may indicate potential problems before the actual changes of the heart rate are detected. So expectant parents should only use a Doppler device under the guidance of a healthcare provider. And even then, when you go in with a change in baby's movements, they don't just check the heart rate, they're doing additional tests. They should be. Here's another common one. If baby's not moving, I should drink juice or eat a Snickers bar or something like that. Again, research has moved away from this idea that sugary drinks and the like are a good way to get baby to move, because kick counts are best monitored without interventions like juice and candy. Again, if baby's not moving like normal, parents should speak up to their provider right away. It's just like when you and I are sick. When we're sick, we just like to lay around. We're conserving our energy. We're not chugging a bunch of Mountain Dew or eating chocolate to get hyped up to go to feel better. We're conserving that energy. Same with baby in utero. If something's going on, whether it's infection, amniotic fluid issue, complication with the placenta, they're most likely conserving that energy, or they can't move because their umbilical cord is tangled. So that's why we don't want to try to force baby to move. Here's another one that is common, I think, especially among multi-generational households. Of course, they're running out of room. They don't move as much. The movements change, right? It's more jabs versus those whole body rolls. But baby should still move up to and even during labor. And if you're tracking your baby's movements, you should still get the same amount of time each day it takes baby to get to 10 movements. Triage. I don't know how many are on today that work directly with your birthing centers and your hospital centers, but if you do, and this goes to that systems level change we'll talk about, make sure you tell your L&D departments to have this material, to have these posters. That's a perfect opportunity to share this information with them. I went to triage 3 separate times with my daughter. My 2 sons, I would always get movements within 5 minutes or less, and she took around 30 minutes. I just didn't know that was her normal when I was tracking. That was her pattern. And so I was also comparing to other pregnancies and my previous pregnancies, which we shouldn't do. So I went and got checked out. Everything checked out fine. She's now almost 7 and wonderful and fiery and spirited. But that would have been the perfect time for labor and delivery to hand me a brochure, to hand me a poster, to say, hey, just understand what your baby's normal is. So then I would be more educated there. And then, of course, we want people to continue their dental care. I think this is a common question or thing where people think, oh, I can't go to the dentist. I can't get things done when I'm pregnant. Talk to your dentist, let them know you're pregnant. Funny story, my dentist was the first person I told when I was pregnant with my second child. I found out the night before I was pregnant, had a dentist appointment the next day, and they asked the question, has anything changed? Are you pregnant, breastfeeding? And I said, actually, I am pregnant. I just found out. So they were actually the first one I told. So couldn't get an x-ray that day. And they know that type of stuff. So again, think systems change. When you're out and about in the community, like I said, you guys do amazing work. You have an opportunity to reach people and to reach organizations I don't, sitting here in Iowa. Could you go to your local clinic? Can you go to your library and share this information with them? Can you order materials and drop them off? Make sure your entire team knows about this. Could you include verbiage in your family care intake forms to talk about this so you don't have to think about it? Working with your clinics there, your health systems, to say, hey, have you heard about this? I'd like to introduce you to Megan. We can integrate EMR, EHRs. Could you add a recording to your phone? Could you add videos in your waiting room? That type of thing. This is a partnership example out of Ohio. This is a community-based organization who integrated Count the Kicks into their intake form, where they just ask after the prenatal care, like, are you pregnant? Yes or no? And then they ask that question. And then if you see people routinely, could you track it somehow where you say, okay, they're 12 weeks pregnant now. I'm going to mark on my calendar to talk to them about fetal movement monitoring the next time I see them 12 weeks from now or something like that. However you want to do it, there's lots of different ways you can integrate this that should make it easy to remember. And I want you to talk about it every time you see them, especially, you know, in the third trimester. Every touch point is important. You never know when it's going to make a difference, right? You never know if it's going to be that poster on the wall or something else that they see. So now we're almost to my second favorite part of the presentation. What do you have access to? What are your free resources? You have a lot, thanks to our partnership with the Arizona Department of Health Services. We have materials in English, Spanish, Navajo, and Swahili. So we're super pumped about that. The first state to connect with us and say, we want this information, but we also want it translated into Navajo and Swahili. We have promo posters like you see here on your screen. We have how-to posters. Those are all great to have in your waiting room. If you have separate like offices where you meet with people, patient waiting rooms. We have app card reminders that you could send home with people. We have brochures. It's all free. This is what our Navajo and Swahili items look like. So we worked with the state who worked with cultural representatives for each demographic. So we could actually get the images to be representative of the culture. So just hats off to the state health department for thinking of this. This is a great pilot and a great project for other states to now look at, and that I'm working with other states to do. So these are our picture-based materials that we have available for free as well. So this is my second favorite part because we're nearing the end of the presentation, but I get to play a fun song just for a couple minutes. I want you to scan the QR code, or I'm actually going to put the link here in the chat. I'm going to say, I want you to go here now and order materials, and you get entered to win yet another gift card. So I'm going to give you like 2 minutes to go there, order the materials you need, the posters, the brochures, the app cards, whatever you need, whatever language. And then I'm going to come back, like, don't go away. We're not done. And then I'm going to wrap up. So go ahead, listen to this cool, fun song, enjoy ordering some free materials, and come back and go. Takes a second for this to go. So
it might seem crazy what I'm about to say. Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space with the air, like I don't care, baby. By the way, because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without.
okay, I'm gonna answer a couple questions here about the materials too while you're doing this. So that's great. If you already ordered it, I'll mark your name down and still enter you into the drawing. So that's awesome. Carissa, your question about the materials electronically, unfortunately, these materials in particular are not, it's due to like copywriting and things like that. But on this next slide coming up, let me show you. We do have, I'll show you in a minute, but we do have a lot of electronic resources you can share with your expectant parents. I'll just slip to that side. We have a parent academy. You can send them a direct link and it has videos. It shows them that, you know, how to count the app. So that's what I would send to your expectant parents if you only meet with them virtually. Or if you can order them and mail them out. I don't know if that's an opportunity that you could ever do, but unfortunately the actual, like the brochure and the posters and the app reminder cards, those are not able to be sent electronically, but definitely check out our Parent Academy, our Provider Academy. That's where you'll find the kick counting charts that you can send, additional videos. Those are all awesome tools that you can use to share with your expectant parents. And then we also have this great resource, this online CE training. It's a little over 2 hours now. We just updated it to include an entire section on equity and inclusion. So I will add this to the email that gets sent to you. So don't worry about like scanning and remembering it and things like that. But what's great is you can use this code SAVEBABIES-AZ and take it for credit. So if you need credit, if you need CME, CNE training or anything like that, or you know people that need it, you can take this for free with our partnership with the Arizona Department of Health. And so I'll send that out in the email too, so you have it with the code. So that's just another great tool. And then like I talked about this. So like I said, we're nearing the end. One other great resource that I wanted to share with you is our Count the Kicks ambassadors. We have women from, and I say women, it is all women right now. That's not to say we won't ever get men, but we have people all over the United States that either come to us because they've lost a baby, they're birth workers and passionate about this, or they're just passionate about it. And so we have them contact us and say, what can I do? And like you all, they are our boots on the ground. We're a national organization, but we're based out of Iowa. And so the fact that we have women and people all over the United States who are willing to do a webinar or come do a presentation in person or go to a baby shower that you're maybe hosting for people or baby fair. And Arizona has one. You have Sean and she's wonderful. And she couldn't be here today to present. Usually I co-present with them, but she did share a video and I want to share it with you to show you why she is a Count the Kicks ambassador and how important this is to her. So let's watch her story or what she has to say.
My name is Sean Similis, and I've been the Arizona ambassador for Count the Kicks since 2013. I do this work in honor of my son, Zach, who was stillborn at full term on July 3rd, 2010. 2 days before we lost him, I noticed he wasn't moving as much and called my doctor's office. Ultimately, they told me that he was just settling down for birth, which I now know is a myth. Evidence shows that babies do not slow down. They do not stop moving before birth comes. In honor of my son, Zach, I am dedicated to helping prevent the devastating tragedy of stillbirth from happening to any other Arizona families. I am extremely grateful for the partnership with the Arizona Department of Health and look forward to working together to reduce the stillbirth rate in Arizona. Thank you.
So Sean is our Arizona ambassador. You can tell she's very passionate. And so she can absolutely help you if you ever have anything in person. So let's wrap up. What are your next steps? Obviously become familiar with the app, which you already downloaded. Order materials, which you've already done. Make sure to have the kick counting conversation and every touch point when you talk to people in the third trimester. Make sure your entire team knows about this. Share the recording with them once I send it out. Think through how you can integrate this. Can you put it in intake forms, update any sort of paperwork that you use? How can you share this with the clients that you serve? And remember, hours and minutes matter. So if you work in a very rural area where birthing centers are, or you're in maternity deserts, you want to make sure you stress to parents that if they have any questions or concerns and it's a 45, 60, 2-hour drive, they need to get in the car to get going to their nearest emergency department, or they need to not wait for their family clinic to open the next day to get checked out. They need to go right away. And so to trust that instinct, encourage them to talk to their provider about it. And then finally, why do we do this? Why is this so important? Why am I so happy that I saw close to 70 of you on here today? And it's because we can save more babies just like Nala. So here in our website, we have all of these baby save stories that we hear about where, parents contact us and say, I was using your app, or I saw your poster, or I was told about this. I noticed a change in my baby's movements. I spoke up and now baby's here because of it. We know there's countless more out there that we don't know about. And when we hear that story from Arizona, we'll shout it from the rooftops. But Again, these are the stories you're going to remember. You're going to remember Ruby, you're going to remember Sean, and you're going to remember Nala. So let's watch.
She came back in after she had me put on the monitor and stuff, and she's like, we're just gonna take her. And I'm like, what? And she's like, you know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself, don't feel bad or stupid, don't worry about insurance or the emergency room bill, go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously, like, it's your baby's life.
So I love sharing her story. I like what she says there at the end where she says, go check on your baby. It's your baby's life. And that's the message, right? Like, go check on your baby, trust your instinct, trust the data, go check on your baby. And so thank you so much. Make sure to follow us. We have all these different social media accounts. You can share our stories, sign up for a newsletter. I see a lot of you have already ordered material, so that's awesome. Feel free to reach out to me. I'm here. I can answer any questions that you may have. I'll take a look at the chat and the Q&A. So we're really happy to be in Arizona, and I can't thank you enough for all the work that you do, and that I saw a lot of you who didn't know about Count the Kicks before today. So hopefully now you can take this information and you feel comfortable talking about it and talking about it with your families. And it's because of you that we're going to save babies from preventable stillbirth in your great state. So happy to answer any questions. If not, you can go ahead and log off, and I'll stay on for a couple minutes. It looks like I have one question. Do you have Navajo as a language that you offer on the app? If not, who would we need to speak to get this language on the app? Great question. We don't have it on the app yet. You would speak to me. I also work on the app with our developer. So I will go back to the state and say, what do we think about that? And like, let's get this done. So we are doing an update soon. So maybe that's something that we can just add in there. So thank you for that recommendation. So I answered that one. Let's see what else. Thank you all. I try to order, but I can't. Oh, that's weird. Did you, what happened there where you couldn't order? Somebody said that. Chris says, I've been alerting members of your app for a while now, but finally got to attend the webinar myself today. Knowing more will help. Oh, good. Thanks. Materials ordered. I'm just looking. I do send the charts to my members that don't have phones. Perfect. Thank you. Reach out to me if you couldn't get ordered. Let me know. Yeah, Suzanne raised her hand. Let me see if I can unmute you. I copied the link and go to the web. Yeah. Oh, sorry. And then there's the spot that says order materials. Click on that and then your state. And then Suzanne, let me find you and unmute you. But if you still have trouble ordering, let me know. Yeah, go to order materials and see if that works. and then you'll click on Arizona. Suzanne, where'd you go? There you are. Okay, Suzanne, I allowed you to talk. So you can talk if you'd like. Or maybe not. Oh, is it supposed to be a thumbs up? Okay, that works too. Thanks. Awesome. I'm just checking through. Oh, this is another Q&A. Hold on. Already answered. Okay. Okay. Just making sure I get everything. All right, I'm going to go ahead and stop recording.